The image of a doctor in a white coat is arguably one of the most recognizable professions we have here in the US. Generally speaking, there's a wide understanding of the kind of work they can do and the ways they can treat patients. But how much do you know about the training process for doctors? People aren't born doctors. They're trained through education, study, and testing over many years. Today we're talking about that in-between period, where doctors develop the skills they need to be safe, impactful practitioners. Today we're talking about residents. You're listening to MedBoard Pulse, a podcast by the State Medical Board of Ohio. I'm your host, Jerica Kent, Chief of Communications. Let's talk Ohio. I'm not too embarrassed to admit, my first introduction to the concept of residency was in a popular medical drama. I'll give you a hint, there were characters nicknamed McDreamy and McSteamy. And that crash course helped to lay some groundwork for me in understanding how physicians are trained. For those of us who weren't sucked into the show, or who don't have anyone in their lives who became a doctor, let's recap the basic steps it takes. A person that wants to pursue a career as a physician must first receive a bachelor's degree. Oftentimes we see degrees in biological sciences like chemistry or biology, although that isn't necessarily required. The applicant does have to complete, though, however, pre-medical coursework regardless of the degree they receive. In order to get accepted into medical school, students are required to pass and score well on a test called the Medical College Admission Test, or the MCAT. In addition, schools also take into account other aspects of a candidate's application, like GPA or strong letters of recommendation, prior research they've participated in, community service work, examples of leadership, and other extracurricular activities that a candidate may have participated in. Candidates will also complete interviews for their favorite schools. Fun fact, Ohio is home to 7 medical schools, and an 8th is scheduled to open in 2027. Once in, that person typically completes a 4-year program. The first 2 years are primarily didactic, classroom-based education, with some exposure to physical examination education and patient contact. The last 2 years, students must complete rotations in different specialties and settings to help to narrow down their area of interest. And also beginning to take Part 1 and Part 2 of the USMLE or the COMLEX if they're in an osteopathic program, which are basically very long exams that measure the student's knowledge and clinical skills. And that's because when they near the end of medical school, they have a big decision to make, to choose a specialty and to begin another round of interviews, which could take them literally all around the country. In today's world, they also have the option sometimes to be able to complete those interviews remotely. The next step, of course, is entering into a residency program, which is where they'll spend the next 3 to 5 years learning and building skills. We have a whole lot left to learn about the residency stage, but before we dive in, we have a Medical Minute segment with Dr. O'Neill. Let's listen in. Dr. O'Neill, you came back again. I can't believe I convinced you to do this. What are we talking about today?
Sure, this is an incredibly important topic, and it's something that's always in need, and that's blood donation.
Ooh.
Did you know that every 2 seconds someone in the United States needs blood? And whether a patient receives whole blood, red blood cells, platelets, or plasma, this life-saving care begins with one person donating blood. So it's incredibly important. And did you know who can donate blood?
Ooh, I don't think I have an answer to that.
Okay. In Ohio, age 16, you can donate blood with a parental consent. You need to weigh over 110 pounds, and you need to be in good health. And what I mean by good health, that means you're able to do your normal activities of daily living. Just because you have a chronic condition does not mean you can't donate blood. If you have diabetes, as long as it's under good control and you're being treated, you can donate blood.
So many people I know are leery of needles. I learned the word trypanophobia, I believe is how you pronounce it. Can you describe what happens when you donate blood in a simple way?
Sure, I'll try my best on that. I think one of the most important things to alleviate fear is to know what to expect prior to going to donate. And you can look at the American Red Cross or the CDC websites, and they have a lot of important information there for you to do your own research. And I think that's important. But prior to donation, typically there will be a, health information assessment, and your vital signs will be performed. That means they'll get a blood pressure, a heart rate, etc. And they'll take a small amount of blood from your finger to measure the oxygen carrying capacity of the blood. That's the hemoglobin level. And if your hemoglobin level's of a healthy rate and you meet all the other criteria, you're ready to donate blood. So you'll sit down in a chair, your arm will be extended out on an armrest, and you need to really tell the person who's going to be taking your blood for donation which arm you want to use if you have a preference. Okay, they'll put a tourniquet on your upper arm, and then they'll clean the interior area in the elbow area. They'll use a sterile needle, which is connected to a tube and to a bag. At first, they'll take some blood for testing, but then they'll have you squeeze your hand to try to move the blood out. It takes about 10 minutes. Questions always asked, does it hurt? Yes, but it's only a pinch and it's very, very fast.
Damn, that's not too bad.
You know, when donation's finished, you'll have a snack, you'll rest, and then probably 15 or 20 minutes later, depending on how you feel, they'll let you go home. Typically, it takes about an hour to donate blood.
I always love the snacks at the end. That's probably my favorite part. Why is blood donation so important?
Well, as I said, every 2 seconds someone needs blood in the United States. Every day, we need about 36,000 units of blood. Okay, we need about 7,000 units of platelets, and we need about 10,000 units of plasma. This is every day. So, and the need in transfusion to each patient is about 3 pints of blood. And remember, blood has to be used within 42 days. Okay. If it's a platelet, it has to be used within 5 days. So it's not something that you can put in a refrigerator or freezer and get out 6 months from now. It'll still be good. So it's really important. We have to have that supply oncoming. And something that's really important, if you know your blood type and you have type O negative blood, that's always in great demand. And it's always in short supply because that can be transfused to patients with all blood types. But only about 7% of people in the United States have that blood type.
So if someone listening to this episode wants to try to donate blood for the first time, how can they sign up?
You can go online to the American Red Cross Blood Services. All you have to do is put in your zip code and a list of donation sites will appear and you can schedule an appointment. It's very, very easy. And sometimes, or most of the time, you can do your health questionnaire online. So that's already done.
Awesome. Thank you so much, Dr. O'Neill. This is incredibly helpful information. I know blood donation saves lives, so we want to make sure people understand how they can get it done.
Perfect. Thank you so much, Jerica.
In today's episode, we're talking about what it takes to become a doctor, specifically the stage of residency. Residents are doctors. They've graduated from medical school, and they have an MD or DO behind their name. And because they are doctors, they must be licensed by the medical board. So I invited a colleague of mine to speak a little more about this. This is the process of becoming a licensed resident in the state of Ohio.
My name is Brandon Morand, and I'm the Chief of Licensure with the State Medical Board of Ohio.
And Brendan, we're talking all about residency today. What kind of license do residents typically apply for at the medical board?
Typically, residents apply for training certificates.
These are still doctors, so it's not like they're not permitted to practice medicine. Like, how do you explain a training certificate?
So they're still doctors. They graduated from medical school, but they're doctors in training. So they're practicing under the supervision of a full doctor. So they're in a training program at a training hospital, and they've typically gone through the match process, that very exciting process that typically happens in March, and they find out which specialty or which program they've matched into. And in Ohio, once you find out which program it is, they apply for the training certificate, which is tied to that program. And then once it's issued, they would practice under the supervision of that physician in that program. If for some reason, the the physician in training gets into their residency program and they're like, oh no, I don't like this type of medicine or this specialty, they can surely change their program. However, the board does need to be notified. Anytime a resident changes their program, they do need to submit the training program change form to the board. That way we can update our records. A new training certificate is not needed. In that change form can be found on our website, med.ohio.gov. And should they have any questions, definitely contact the board. We're always here to help, and it is a very exciting time.
So how long do these licenses last?
So these certificates, they're good for 3 years. And whenever the certificate has expired, if the program is still ongoing, they can renew the certificate for another 3-year duration. But if the certificate has expired and they're done with the program, they can apply for a full license with us.
How many TC applications does the board process every year?
On average, it's around 2,600. Last year, we did about that very same number, and for this year we expect it to be a little bit higher. Looking on the trend, every year we add a few hundreds more. So if that trend holds true, we will have another busy season ahead of us.
Wow. And we need that license to be able to practice in these programs, is that right?
Absolutely. If you don't have it, you cannot practice. It is not a good thing if you're practicing in a program without having an active and issued training certificate from the board.
Well, thanks, Brandon.
Of course.
Again, it's a busy season, but we're excited to welcome these new applicants in and hopefully see these licensees in Ohio.
Of course, we're always happy to have them, and we're always excited to work with new matches and new residents. Congratulations again.
Residency is one of the final steps on an individual's path to becoming fully licensed as a practicing physician. And there's a whole process that goes into determining where each person is placed. So I decided it would be helpful to hear from a few graduating students in medical school and to understand what their process has been and where they are in their journey. Can you please introduce yourself?
Sure. I'm Alessandra Derrick. I'm a fourth year at Ohio University Heritage College of Osteopathic Medicine at the Dublin campus.
Awesome. And where are you from?
Columbus, Ohio, born and raised. I grew up in Upper Arlington and lived there with my parents, and they're still here. And then I went to Miami University for undergrad, and then returning to Central Ohio for my medical education.
Awesome. What led you to pursue a career in medicine?
Yes. So both of my parents are in healthcare. My dad's a physician and my mother is a pharmacist. And I think growing up from a young age, I just appreciated how much they loved their job, how much they valued their education. And honestly, they also took on a leadership role in the community. People looked up to them. And I really loved this aspect, even as a child. So I knew I wanted to do something in healthcare. In high school and undergrad, I loved science. I loved physics, anatomy, pathology. And then towards the end of undergrad, I was just looking for a very comprehensive, broad education, and that ended up being medical school.
Thank you for sharing that. I guess my next question for you is, can you explain how the match process works?
So to arrive on match day, it is a long cycle, but it starts with completing an application. This usually has letters of recommendation, personal statements, board scores, research, opportunities to explain hobbies or service opportunities that you've done. And then you will submit your application, and hopefully programs get to know you and they want to offer an interview. And the interview season is late fall into the winter time. And hopefully you get as many interviews as you wanted. And after you interview, you will rank the program. So it's encouraged to rank as many programs as you interviewed, as it increases your chances of matching. However, it is a binding contract. So if you do not want to train at a certain program, you should not rank them. So you will, as an applicant, you'll rank your desired programs from most desired to least desired. And then the programs, as they are interviewing all the applicants, will rank their favorite applicants as well. And when it gets put into the system, it does prefer the applicant. So the system will match everybody's 1 through 20 or 1 through 15 and all of the different applicants from the different programs. And hopefully it's a mutual great experience.
And this happens all around the country, is that right?
Yes. Yes. You can rank any geographic location.
Wow. So it's a waiting game a little bit, it sounds like, and you're the idea of matching together, but you're both trying to hopefully have the same level of priority for each other. It does remind me of dating.
Yes, it is like that. I've also heard it compared to the sorority recruitment as well. I guess it's a very similar process.
Fair enough. Thank you for explaining that. What specialty are you then wanting to go into, and then why?
So yes, I am pursuing ophthalmology, and I'm very fortunate to do so. Um, I first was exposed to ophthalmology. I was in high school, undergrad. I was an ophthalmic technician, and so I worked in an ophthalmology office. And then I also went on a mission trip to Nicaragua, and I supported some ophthalmologists as they completed several cataract surgeries there.
Hmm.
So when I decided to go to medical school, I had ophthalmology on the mind, but I wasn't completely sure. I loved everything in medical school. I was fascinated by everything. But I also spent a lot of time in a free clinic throughout my years of medical school. And I really realized that ophthalmology was not reaching many of our underserved communities. And this really instilled a passion for serving underserved communities and helping to increase access of ophthalmology. So that kind of grew my passion, and really excited to apply and become an ophthalmologist.
My name's Colin Wilson. I'm from Youngstown, Ohio. Grew up there, went to Austintown Fitch High School, then went to the University of Akron for biomedical engineering. A little bit about me, I guess, is I don't really have anybody in my family in medicine. Being a physician was something I thought about when I was in high school, and like I did volunteer efforts. I volunteered locally there, did some work to like kind of get exposure and see if it would be a potential interest of mine. But at the time, it seemed kind of bold to just say, "Hey, I know for a fact I want to be a physician," with just not having like the mentors or like the path shown for me, I guess, to say. And I love math and science. I wanted to combine that with helping people. So I pursued a biomedical engineering degree at the University of Akron. Loved my time at the University of Akron, was super involved, met a lot of great people, kind of really like developed who I was as a person there, I said, even more so. And I graduated with a year between when I could do my application to medical school and kind of take that step. So originally was pursuing a PhD actually at Cleveland State in biomedical engineering. Kind of some opportunities came my way that it was hard to say no to. But I enjoyed my time there, but I'm more of a people's person, and the COVID pandemic happened like halfway through my first year of that program. I had time to reflect on what I really wanted and where I want to go in my life, and then kind of built up the confidence to take the leap. Got my master's in biomedical engineering, and ended up at OU's Cleveland campus, and could not be happier with my choice. So there was a couple experiences along the way that kind of shaped this for me and making this possible, and definitely the relationships of mentors and um, classmates, friends, my support systems helped make this a reality. So really what changed it for me was I got partnered with he's still a mentor of mine now, but a pediatrician from Akron Children's Hospital. And essentially I was involved with the enrollment for it was called Managing Asthma Triggers at Home program. So through this, we were partnering with the public health department, Summit County Public Health Department, and their clean air department to provide home resources free of cost to our high risk families and children in like the Tri-County area around Akron Children's. It was a very eye-opening process for me, understanding that to help somebody, you really have to understand their whole situation, the whole perspective, beyond just the clinic walls. And so when I was in this program, there was a high no-show rate in the clinic, and there was some frustration with that, understandably. But when you really drilled down on what was going on, you realize that like phone numbers were no longer active. Patients were using prepaid minutes and would run out. Families were in between, housing. So we weren't really tracking people down or keeping people, keeping that continuity with our patients. Oftentimes families had one car, no car, balancing work responsibilities, just a lot of different things that made providing care tricky. And with one of she became an excellent friend and somebody I looked up to a lot at the health department. We started doing home visits and reaching out to families to figure out what was most convenient for them. And it's kind of that family medicine attitude of like, to truly care for somebody, I have to understand like all the full picture that goes along with them.
How did that then shape, family medicine is what you want to go into, but how did that shape the setting that you want to be?
I think I primarily want to practice in an urban setting. Also have interest in caring for rural populations as well. In general, I know that I want to advocate for those that are traditionally underserved in our healthcare system.
Absolutely.
Whatever that looks like, I'm not totally sure yet. There's, I guess, a long way to go in my career and see where things take me, but I do want to invest a lot of my time caring for those that, being on the side of those that are traditionally underserved.
What are you most excited about then in the residency program that you're hoping to match in?
It's both really exciting, but also extremely nerve-wracking to be somebody's physician, the responsibility that entails. I think I am excited to give back to the communities that raised me, that I grew up in, that trained me. I think I'm also excited to be a part of a team. I really enjoy that aspect of it, learning with your fellow residents, faculty, to be somebody that others can rely on, to be a good team player, to contribute to the healthcare of our program, but also like the communities at large.
So thank you for having me. My name is Sean Diamond. I'm a fourth year medical student at Ohio University Heritage College of Osteopathic Medicine. So I grew up in Virginia Beach, Virginia. My dad was in the Navy for 25 years, and my mom is an immigrant from the Philippines. My dad was stationed out in Norfolk for most of his active duty service in my lifetime. And I went to undergrad at George Mason University, which is up in Northern Virginia. And now I'm here at Ohio University in Athens.
Awesome. You're the first person I've talked to who's not from Ohio, so it's fun to hear people who are coming in from a different place. What led you to pursue a career in medicine?
I am part of the first generation of college students on both sides of my family, and I chose to go into medicine for a variety of reasons. A lot of it starts with the connection to the military that I had growing up. When I was in high school, I was part of a math and science academy that was a public school that you had to apply to get into. It was a special curriculum, and we did a project that was regarding like something in the community, and I chose to research the American healthcare system, learning about all the different facets of it, and then also wanting to understand how military healthcare is delivered as well. I was volunteering with local veterans in our community, disabled American veterans, and learning about all the different barriers to accessing care, especially within the VA healthcare system, with regards to claims for disability, with regards to mental health, physical health. One of the people, the commander of the chapter, shared that for many veterans in our VA healthcare system, that about every 2 years or so, they have this replenishing like wheel of primary care docs, and that recounting the stories of service connected traumatic experiences, physical, mental, was incredibly challenging for them. I went off to college with all this information, and from there started researching deeper on mental health care barriers for veterans. And at that point, I had thought I wanted to pursue it from more of a healthcare administration perspective,
Mhm.
thinking I wasn't qualified or smart enough to pursue medicine. But then I had a dislocated ankle injury playing basketball at the school gym at George Mason. And from then on, I just saw all of our healthcare system up close, like as a patient. And those experiences, in combination with the seeds planted back home and recognizing the barriers to healthcare for our vets, I just said to myself, I think that this is something I want to pursue. And so, following that sports injury, I changed my path to go into medicine entirely. And from then on, the whole mission and my mindset has been to take care of veterans and to take care of underserved communities, historically marginalized populations in healthcare. That's been my personal mission from the beginning. And I've wanted to pursue it from the lens of primary care this entire time.
You mentioned mental health multiple times. Did you at all consider doing like psychiatry or anything that would be a little more geared towards mental health?
Yeah, for a while, I had thought about becoming a psychiatrist. But what I love so much about family medicine is that it's such a broad specialty in the types of things you get to treat. I really enjoy and think that the VA could benefit from having more primary care doctors specifically to address mental health care, to address musculoskeletal care, diabetes, chronic disease management. There's so much to it. And
Mm.
something I didn't mention was that when I was accepted into Ohio University, I was applied for a scholarship with the VA HPSP program. So upon completion of my residency, I will work in the VA healthcare system for at least 6 years following
Mm.
completion. And I mean, that's been my mission from the start. And I'm
Yeah,
grateful to have had that additional financial support, because medical school is not cheap. That's for
it's
sure.
not cheap. Do you have an idea about where you want to be located?
Yeah, I think ideally I would love to end up back in Southern Virginia where this whole journey started. I think giving back to the community that really aligned me towards this path towards medicine is ideal. I think about all the different vets that I encountered back home when I was in high school, and them just saying like, wherever you end up doing, like, come back and take care of us if you can, even if it's from a leadership perspective and not being a doctor.
Mm.
But all those vets believed in me to go into medicine too. They've always have. I remember her name's Commander Bailey. She still reaches out to me, and she's always been so supportive. And I think that is absolutely, I'd love to go home and take care of that community that I grew up in.
Absolutely. I love that. What are you most excited about for the upcoming residency that you will be taking part in?
I'm just really excited to get started and working. I feel like we've done now 4 years of medical school, and I'm ready to apply what I've learned and to take more of a responsibility over a patient's health and to really start making a difference. I feel like what is unique about my backstory and experiences, especially being able to relate to patients who don't understand the healthcare system. And I understand what's challenging because I experienced it myself. And I'm ready just to start that advocacy piece. I think advocacy is something that doesn't have to be grandiose, doesn't have to be changing all these things in the systems, but just starting in the patient room, advocating for your patient. That's what I'm excited about the most.
Awesome. Well, I'm excited for you, and I hope that you matched where you want to be, and look forward to seeing you. I mean, even if you leave Ohio, we'd like to have you, of course, as a licensed physician in Ohio. But even if you end up going somewhere else, I'm sure your future is bright. Thank you so much for talking today and sharing your experience.
Yeah, thank you for having me again.
I love getting to hear the stories that have shaped these students' paths toward medicine. We'll be right back to learn more and to find out where each student matched after this commercial break.
The Medical Board meets the second Wednesday of every month in the Rhodes Tower in downtown Columbus. During these meetings, board members deliberate on potential disciplinary and policy matters. If you cannot attend our meetings in person, you can still watch virtually. Technology permitting, the Medical Board's monthly meeting is available on our YouTube channel. Just search State Medical Board of Ohio or go to med.ohio.gov and visit Current Board Meeting Agendas and Minutes to access the link.
Healthy aging starts with the right support, and the Ohio Department of Aging is here to help. From wellness programs and falls prevention tips to resources that keep you active and connected, we are committed to making Ohio the best place to age in the nation. Learn more and find services near you at aging.ohio.gov.
You're listening to MedBoard Pulse, and in today's episode, we're talking about the important step of matching with the residency program, which is where physicians receive the training needed to enter into their specialty. We heard it described as a matching process similar to a sorority house that involves ranking in both the end, the applicant, and the program. I have to say, I've kind of marveled over this over the years, and the magnitude of the process, matching students or programs from all over the country. I started wondering how many people were involved in the process. And the National Resident Matching Program is the organization that places applicants into residency and fellowship positions. And in 2025, it reported 47,208 applicants submitted certified rank order list of programs. And after matching was processed, 37,667 of the applicants obtained first-year positions. Sometimes that means the applicant is staying in their hometown, or at least their home state, but sometimes that means they're packing up and moving across the country to fulfill their dream of becoming a doctor. But if you're paying attention, that means not everyone matches on the first try. In fact, there are options available to those who don't initially match. They can see, for instance, if they are eligible to apply for the Supplemental Offer and Acceptance Program, which is a pool of candidates to match with the remaining unfilled positions. If that's not possible, students may seek out opportunities to make them more attractive as a candidate at a future date. For instance, they may choose to get involved in a research project, or find a job in a clinical setting, or work with medical schools to perfect their application and apply in the next cycle. All in all, these decisions are not taken lightly, and they often shape the lives of these young practitioners. Of course, we've heard from 3 graduating medical students that are right on the cusp of this next stage. We recorded these interviews before match day, and now it's time to follow up and find out where they'll be completing the training.
I'm Alessandra Derrick. I matched at Ohio State in ophthalmology. I'll be staying in Columbus, so I'll be able to stay close to my support system, my family, my fiance, and I'll be able to stay connected with many of my mentors.
This is Colin Wilson. I matched at Ohio Health Grant in Columbus. I'm looking forward to joining a great team and caring for my patients.
My name's Sean Diamond.
I am so pleased to announce that I matched at my number 1 choice at Eastern Virginia Medical School at Old Dominion University in Norfolk, Virginia. I will be going back home to the 757, my community, who inspired me to pursue medicine from the beginning.
I cannot be more excited for these 3, and I'm so happy they were able to come on the show. We wish them all the best. And congratulations to the entire class of 2026. I'm sure we'll be seeing your applications very soon. I hope you learned something new today, whether it helped you gain more respect for the education and training your physician had to go through, or it inspired you to consider pursuing a career in medicine. We hope you tune into our next episode, where we dig into another hot topic in medicine. Thank you for listening to this episode of MedBoard Pulse from the State Medical Board. Special thanks to our Chief of Licensure, Brandon Morant, for sharing information about the training certificate process. Of course, I'd also like to thank Alessandra Derrick, Colin Wilson, and Sean Diamond, graduating students from the Ohio University Heritage College of Medicine, for sharing your stories and the news of your matches. We know you have bright futures ahead of you. For more information about the medical board, visit med.ohio.gov. You can also email questions or comments to communications@med.ohio.gov. And remember, the more you listen, the more you'll learn, the more you'll share.